name is Rais Vohra. I'm the medical director with the Fresno Madera Division of California Poison Control System. And I'm joined today by Mark Halverson with the Fresno Chaffee Zoo. Thank you so much, Mark. And thank you to the Fresno Chaffee Zoo for this amazing partnership, which is has been going on for many years. We love collaborating and teaching our communities together. As you may be aware, this week is National Poison Prevention Week. So we're really highlighting the amazing job that all poison control centers do all over the U.S. with our toll-free hotline, which is available for all callers, whether they are parents of young children, patients themselves, professionals, paramedics, law enforcement, certainly clinicians that are working in our hospitals. We help all callers about really all toxins. So, medications, overdoses, street drugs, and what we're going to be talking about today, natural toxins like what you find with rattlesnakes. So we love doing this activity. This is the Rattlesnake Awareness Day, or RAD, and we think it is rad. We love talking about this topic. We want to keep people safe, and we like the timing of National Poison Prevention Week because this is really the time to become aware of rattlesnake bites. And so we are here to show you and talk about the biology of these amazing animals, how to stay safe and help protect them and preserve them in their natural habitats, but also how to stay safe while you're enjoying the great outdoors. And then really, if you have the unfortunate event of having a snake bite, really the best practices for first aid and management that are available to help people with snake bites. The good news is, even if you do get bitten by a snake bite, it's actually got an excellent prognosis, and we have a lot of great experts all over California, including at the national and state levels of poison control. And we help people all the time, every year, with snake bites. And our staff has told us that we've already got snakes biting in California. So they're starting to come out of hibernation. You might come across them either while you're hiking or enjoying the outdoors. Some of you who live in the foothills or in more natural areas may actually even have them on your home property, etc. So just be aware that they're out there, that we do expect snake bites, as we do every year around this time. And we want to keep everybody safe in whatever they do when it comes to staying safe around snakes. And with that, I'll pass it on to my colleague Mark, so he can give you a little bit of a background about just the biology and the amazing, facts just related to how these animals live in the wild. Go ahead,
Coming out
Mark.
of hibernation, and they get out into the environment looking for food and then for suitable mates to breed and make more rattlesnakes, and then usually active through the summer and into the mid-fall and go back into hibernation in mid to late October. So all the times that we're active out here in the foothills and out in the valley floor is when you're going to see them. There are up to 8 rattlesnakes that are found here in the state of California. The primary one we see here in the valley is the northern Pacific rattlesnake. If you go a little bit further south down into the LA area, you'll have the southern Pacific rattlesnake, the red rattlesnake, the western diamondback, and several other species that are found over on the eastern side of the Sierras. But primarily here in the valley, you're going to see the northern Pacific rattlesnake. They are a pretty iconic animal. They have a diamond-like pattern on their back. No matter where they're found, they're pretty much similar in coloration, usually a drabber olive to yellow with some camouflage pattern on the back, but they will have that distinctive rattle. We do have some snakes that kind of look like rattlesnakes here in the valley. You can see gopher snakes that are out and about. They do mimic the behavior of rattlesnake to make themselves look a little more dangerous than they actually are, but they don't have a rattle, so it's one of the key ways to determine the one versus the other. But some things you can do to keep yourself safe when you're out and about out in the foothills or here in the valley floor is to always stay on marked pathways. Don't stray from the trail. Always have a second person with you. Don't hike alone. Make sure you're out enjoying nature and out and hiking around with a second person in case there is an issue. They can help respond to that problem. Around your homes, if you want to reduce the amount of opportunity to come in contact with a rattlesnake, you can remove a lot of the debris around your home so you're not encouraging them to come and hunt for rodents and other prey items. So you clean up around your house and you can keep them from being found in your home where they could be dangerous to your pets and your kids, as well as yourself. And then one of the most important things to remember is if you come upon a rattlesnake is don't try to move it. Don't grab it. Don't get it off your pathway. Just back away and let it go away. Most bites tend to happen when someone picks up a rattlesnake or tries to move a rattlesnake. But with that, I think that pretty much covers everything else. I can give it back to Dr. Vohra.
Thank you, Mark. Just amazing animals. Really love hearing about their biology, the diversity of different species that we have here in California and in the Southwest. And whenever people see snakes out in nature, we really want to advise them, please leave them alone. Be far away from them so that they're not able to be within striking distance, it's called. And our interactive cart can actually show you exactly what that striking distance can mean. But unfortunately, we do have snake bites that do happen in our state. And so another topic that we wanted to touch on is what to do if you actually get bitten by a rattlesnake. Now, the good news is this is a very treatable injury. And you really want to make sure that you get to a hospital as soon as possible so that you can get the best treatment for a rattlesnake bite, which is called antivenom. Antivenom is an IV medication. It works very effectively to help neutralize and slow the damage and really arrest the progression of venom whenever it's acting on the tissues of the body. But let me back up a little bit and talk a little bit more about the venom itself, because that's, our understanding of how to treat snake bite is really dependent on a lot of the amazing research that scientists have done about the effects of venom. We know that venom seems to be a mixture of many different compounds and that it tends to cause several different things in a human body. First, it can really cause a lot of damage to the local tissues. So whenever someone is bitten, either on the hand or the foot, those are the most common things where people get bitten. Whenever they get bitten on their extremities, we know that we can expect those extremities to develop pain and even swelling and even changes in their skin. So we've got a few models of a human foot here developed by our amazing technicians at the UCSF Fresno Clinical Skills Lab. So we really want to just thank our partners at UCSF Fresno, including Lee Haggerty, who has just with his hands crafted these really nice models of what snake bites can look like in a human foot. And you can see that it's kind of a progressive injury, where first you can get a little bit of just skin discoloration, maybe a little bit of swelling just at the site of the bite. But then as that venom kind of goes under the skin and digests the different tissues, you can actually have a large kind of expanding area of injury with lots of swelling, even blister formation, and even cratering and bleeding out, depending on exactly what happens with that venom as it interacts with the tissues of the body. So we know that there's a digestive process going on that we can see that's very evident and that we track very closely whenever the person gets to a hospital so that we can see if we need to give them more antivenom or how the patient's doing. We also track the blood because it turns out that the blood work can also reflect venom effect. And so you're going to have your blood drawn. We're going to be watching that very closely if you get a snake bite in the hospital. So those are some of the ways that doctors help track how bad is a snake bite, kind of do that risk assessment, and then that allows us to make judgments about whether the person needs antivenom, needs more antivenom, how they're doing, whether they're recovering, etc. The good news is that the prognosis is excellent. Most people who get antivenom, especially within the first few hours, especially within the first hour, do extraordinarily well. They have typically a 3 to 5 day hospital stay where they recover, and then they're able to kind of get functional use of that limb. Usually by 6 weeks, they have fully functional use of that limb, but it doesn't take 6 weeks to actually feel better. Most people are going to feel better just in the next few days, and then they'll kind of be fully functional with that limb in the 6 weeks. So even though this can look really bad, and if you go on the internet, which I don't advise, but if you go on the internet and look up snake bites, then you're going to see a lot of just very graphic images. Just keep in mind that in real life, the prognosis for snake bite is excellent. We just need to make sure that people get to a hospital and get antivenom as soon as possible. Before they go to the hospital, there are a couple of different first aid things that you can think about doing. The most important first aid you can do is call 911. Do you know what happens when you call 911? What happens? Who's gonna come when you call 911? Who's gonna come whenever you call 911? If you get hurt in a medical emergency? The ambulance. That's right, the ambulance. The ambulance is gonna come. and they're going to come and go ahead and pick you up. Sometimes if you're out in the wilderness, you may even have like things like wilderness medics or even park rangers, depending on where you are. So all of us work together in the pre-hospital realm, and they will rapidly stabilize and transport you to get to a hospital. If you're in an area where you're just not even able to call 911 or get an ambulance to come see you, then you can do just a quick wrap of the extremity yourself or with a partner, and that will kind of help stabilize that extremity and keep the venom from spreading so quickly, and hopefully that will slow down. We're just trying to kind of set up roadblocks. So if you think about venom just kind of making its way like a wildfire and just digesting all of the tissues in your body, you really want to set up, blocks for the spread of that damage. And the way that we do that is what's called a splint wrap, and we're going to show you how to do that. The one thing that you don't want to do is apply a tourniquet. So that's another big no-no, is do not apply a tourniquet whenever you have a rattlesnake bite, because that's really counterproductive. It's actually not going to make for a better outcome. Even though you see that in the movies all the time, unfortunately Hollywood kind of promotes this myth of using tourniquets for all snake bites, and that's really not something that's recommended in real life. So you want to make sure that you're not applying a tourniquet. My friend Lee's going to show us how to do a splint wrap, and I'm going to just kind of walk through what that process looks like, and I'll have volunteers to kind of partner up, and then you can actually splint wrap each other. But first I want you to watch how we do it so that you know exactly what you're doing. So again, this is not a tourniquet, this is a more loose wrapping, and you're really just setting up a little bit of a roadblock so that that venom does not go all the way to the shoulder or the torso or the hip, and you really want to keep the venom at the site as much as possible with the use of a simple kit. It could be a stick, it could be a scarf, it could be a combination of those. We like to do what's called a splint wrap using a stick as well as a roll, and that's what we're going to show you here. Are you ready, Lee? Okay, so we're going to pretend that Lee got bit right here in his hand. Maybe reaching into, this is a very common story, people are reaching into a space where they can't really see what it is, like into a bush maybe, etc. And that basically will be maybe a spot where a snake may be surprised, and a snake will just out of defense bite the person. And so we often see bites on the hands, and that's exactly the story, is they were basically reaching into a space, they didn't know what was in there, maybe they didn't have good visibility, and then they got bitten by a snake on the hand. That's the most common story. So I'm sorry that happened, Lee. So first you're going to get a stick if you have a stick available. If you don't, it's okay, but the stick is a good protector of making that, preventing that tourniquet from forming. So first you just put a stick right along the extremity that you want to wrap, and then you can just get a roll. It could be a scarf, it could even be just an item of clothing, and you can basically just very gently apply a roll of cloth. This is a special cloth called acrylics cloth, and I really recommend that if you are hiking, get a first aid kit. We have very small first aid kits available that our amazing health education team developed with us. But basically your first aid kit should always have some sort of a cloth like this. They come in so handy if you have a cut, a scratch, or in this case a snake bite, because this allows you to create a very easy wrapping that then immobilizes the hand so that they're not moving, like for example the wrist and the rest of the hand and the arm. And that hand and that arm, basically whenever it's not moving, the venom is not going to be propagated by muscle pumping, and it's going to stay where it is so that you don't have a spread of that damaging venom all over the arm. So you're trying to stop the spread of the venom, and you're also trying to keep the person comfortable, because if they immobilize the arm, it reminds them not to move it around too much, and that basically kind of reminds them that they should stay still, not exert themselves too much, stay calm, and then they can basically be just like this until they get to a hospital. And then at the hospital, they can remove all of this, assess what's going on, mark the swelling, maybe with a pen, maybe even ultrasound the area to make sure they know what the damage looks like on an ultrasound. And then they can basically apply the antivenom as soon as possible. And that antivenom is really going to stop that venom. It's going to neutralize that venom and keep it from spreading and progressing more. And that's the best treatment that we have for snake bite. And then you can even add a sling, which is something that Lee has I think, have you crafted a sling here? So you can also add a sling like this, and then that's another way to kind of immobilize the antivenom. So, and that's how you do a splint wrap, and that keeps your patient very comfortable before they get to a hospital. Again, it's not a tourniquet. You don't want to tie a tight tourniquet. That's not necessary. You see that on the movies and on TV all the time. We don't recommend tourniquets for rattlesnake bites. The most that we recommend is a splint wrap. But really, all of this should be done after you've called 911 and arranged for transport, and really try to get transport there as soon as possible so we can transport them to a hospital where they can get definitive care with antivenom. Okay? One thing you didn't see me do is, again, I didn't do a tourniquet. You also didn't see me. I love you, Lee, but I'm not going to suck on your wound because that's something that we don't recommend, okay? We just don't, you see that in the movies all the time. That's not safe. That actually can introduce bacteria into the wound, and it doesn't do anything in order to suck out that venom. That's just not how the venom works. We actually have an amazing skeleton of a gaboon viper, which is related to rattlesnakes. They have a similar apparatus for biting, and you can sort of see that they always have kind of curved teeth. So if you think about curved teeth, the path of those bites is really hard to figure out. So suction doesn't really work whenever you have kind of a curved path like that. And so that's another reason why suctioning or sucking out venom is really not something that's going to help at all. It's just going to delay care, and it might introduce bacteria, which then creates another problem instead of actually solving it. So you don't want to suck on the wound, and you don't want to do a tourniquet. And then there's other things people try, like freezing it or applying ice to it. You don't need to do any of that either, because that's not going to help, and in fact that might delay care. All you really want to do is call 911, do a splint wrap if you have the supplies available. If you don't have the supplies available, just advise the person to just stay still and make sure that you stay calm, because this could be a very scary time. Imagine being bitten by a rattlesnake or a venomous animal. It can actually induce a lot of panic, which can increase your heart rate, increase your blood pressure, maybe even make you throw up, and you don't want to be doing any of that, because that's not going to help. So remember, stay calm, you're going to be fine. You just got to get to a hospital so you can get antivenom, and in the meantime you can do a splint wrap, which is just a good first aid skill to know anyway, just in case you have other injuries like a sprain or a broken bone. You really want to know how to splint an extremity on a hike, so that in case you need to immobilize someone and keep them from getting hurt further, you kind of have this skill set and you know how to use these supplies. So with that,
We want to practice?
yeah, so with that, if anybody wants to practice, pick a partner and come up here, and we have lots of supplies.
You wanna practice, learn
and
how
you can basically learn how to do a splint wrap
I'm happy to
on
show
a
you.
partner, maybe even groups of 3 if you want, and we'd be happy. And you grown-ups can come on up too, and we have lots of supplies, so feel free to come up and use these sticks and these splint wraps to come and learn how to do this very important first aid step for rattlesnake bite.